It was on a Monday morning at work about 6 months ago that I was sitting there when I noticed my entire leg started to swell up. I was shocked when I got home and noticed my entire leg up to my hip was huge. It wasn't until I actually went into the lymphedema clinic that the physical therapist just told me, flat out that that's what it was. She had recommended the Flexitouch, and I can go to bed without any kind of garment on and wake up and the swelling is pretty reduced. I can usually say close to normal by the morning, but it just takes a few minutes, and once it's on, all you have to do is hit a button and it's good to go. And it gets to work and does the work for you.
Lymphedema is an important cardiovascular disorder associated with the accumulation of fluid in both the legs, arms, and the trunk. Mobility is decreased, quality of life is decreased, independence is decreased, and patients suffer. I'm impressed that as we've created better treatments for cancer, the prevalence of lymphedema has risen by at least 30% over the last 5 to 10 years. So it always surprises me that lymphedema seems relatively unknown to the public and to many clinicians alike. In fact, lymphedema affects at least 3 and likely over 5 million individuals in America alone. And lymphedema is common throughout the globe.
Tactile Medical was founded in 1995 by a lymphedema therapist. She set out to automate the process of treatment that she learned to do in the clinic and try to take that into the home.
Flexitouch, by allowing the fluid and bacteria and proteins to be removed from the body naturally, can reduce the risk of infection. The Flexitouch chambers are small. It has up to 32 chambers and inflate in a prescribed sequence. This pressure actually actuates the lymphatic capillaries, allowing them to absorb the lymphatic fluid and proteins and remove them from the body. Flexitouch is the only device that is clinically proven to stimulate the lymphatic system, specifically to use the physiological principles of manual lymphatic drainage, or MLD, which has long been used as the standard of care to treat lymphedema.
When things go right for a patient with lymphedema, they're able to manage their disease at home through the remainder of their life. The triple aim is our phrasing of our goal to improve individual health and quality of life, to have that occur with improved community or public health, and to achieve that at lower cost. When treated successfully by the patient and their professionals, the patient remains functionally active and independent.
I try and educate people in my own community that this could happen to you at any point. And I think the earlier you catch it, the easier it is to manage. And putting something like the Flexitouch in there just takes the step out of it. And it just adds a layer of care that you might not get every day. It helps me manage my lymphedema on a daily basis.
One of my therapists that I had when I was going in 2012 was getting I'm saying close to the end of my therapy and that. She asked me if I would be interested in knowing more about a Flexitouch pump. And I said, yes. I said, let's see what they've got to offer me. I have nothing to lose and everything to gain. I felt that I got what I needed from the Flexitouch.
In the case of lymphedema, pneumatic compression devices, in addition to manual therapy, offer a viable treatment option to help patients take care of their disease at home. However, there was no real-world data showing the effectiveness of these devices.
It's my pleasure today to discuss the results of an important study published in the Journal of the American Medical Association.
We used administrative and claims data from a large national insurer to understand the effectiveness of an advanced pneumatic compression device to figure out whether it has any impact on healthcare costs and other clinical outcomes, as well as healthcare utilizations of the patients.
When I knew I had lymphedema, of course your heart sinks and you know you're going to have it forever, but I was still determined to keep it away from my life and I wasn't going to let it affect the way I lived my life. So I needed something quick and I needed it to still be a little bit private for me that I could do in my own home, and this was the only solution, and it was the best solution for me at the time.
We want to identify effective treatments that are going to improve patients' health and at the same time do that at a lower cost. And we examined the healthcare cost, healthcare utilization, and clinical outcomes of lymphedema patients who were prescribed the device. And we compared these outcomes in the 1 year prior to them receiving the device to the 1 year post receiving the device. And our study sample included 718 patients, and 374 of these patients had cancer. So when we looked at the total lymphedema-related outpatient costs, excluding the cost of the medical device, we found a large 37% reduction in these costs for patients with cancer and a very similar 36% reduction in the cost for patients without cancer. When we narrowed it and looked at the lymphedema-related outpatient costs alone, we saw a 53% reduction in these lymphedema-related outpatient costs for patients with cancer and a larger 65% reduction in these outpatient costs for patients without the cancer.
As a physician in practice, I'm always seeking to identify studies that are directly relevant to the patient experience. There was a 79% reduction in episodes of cellulitis. This has never been achieved with any other lymphedema treatment prior to this time. There was a 54% decrease in rates of hospitalization, a nearly 40% decrease in outpatient hospital visits, and almost 34% decrease in required episodes of physical therapy-based treatments. These are indeed impressive results.
Certainly in this environment of healthcare cost compression or healthcare cost awareness, there's no better place, there's no less expensive place to care for a patient than at their home. Flexitouch and ActiTouch, our two main products, are really unique solutions to try to treat patients with chronic conditions at home. Flexitouch has the most clinical evidence of any products on the market to treat lymphedema today, and we believe that's why clinicians have such comfort in writing prescriptions for our Flexitouch product.
And then it ended up me getting to the point that I said, that pump that you used on, I need that at home. And here I am, standing in front of someone who's asking me to be in a pageant where I'm gonna wear a gown and heels. I would have never in my wildest dreams been able to share that would have even been on the radar for me 3-4 years ago.
One of the unique things about Tactile Medical is that we help to manage the insurance process with the patient. When you're dealing with a condition like lymphedema, daily living can be a challenge. So having an advocate inside the company to help you get the device that will help treat your symptoms is very important. So after a patient is approved from their insurance company and we ship the device, we actually have a trainer go to the patient's home if needed and show them how to use their device, how to put on their garments, how to make sure that they can get the most of their system and treat their symptoms effectively.
So customer service for us is being able to reach the patient directly, to inform them about their condition, to help them understand the process of payment, then understand and fully be able to use our equipment.
I think it's very important for we who treat patients with lymphedema to try to feel what it's like to have lymphedema for the rest of your life. Can you imagine a life with a swollen limb, with decreased flexibility, with the social stigma that's involved? Can you imagine unexpected skin infections or cellulitis occurring without warning, the requirement to take antibiotics or to be hospitalized, and sometimes not just once, but again and again? If you were such a patient with lymphedema, would you not seek treatment that was proven to improve your quality of life by lowering edema, by decreasing the risk of skin infections by as much as 80%, and do so in a way that is comfortable but can be achieved at your own home?
It's a gratifying feeling to be able to serve these patients, and I think it makes the people at Tactile Medical very proud to be part of a company that can deliver that kind of improvement in patients' lives.